I was working in accident and emergency as an adult nurse, I experienced as much, if not more, violence and aggression there than I've ever done in mental health settings.
The main way I deal with being faced with challenging behaviour is to ask myself, what is this behaviour about? And just in asking the question, you distance yourself from the behaviour itself and from your own emotional response to the behaviour. We encounter people who are distressed and then as a result might present with challenging behaviour. In mental health nursing, I would say fairly regularly, because we're working with people at a time when their mental health is suffering for whatever reason. So, and that is distressing, and people deal with distress and express distress in different ways.
It's often not personal towards us as individuals, but it's often an expression of what that person is experiencing, maybe the symptoms of the illness that they're going through. And I think it's just being aware of that, that we're aware that there is probably a cause, an underlying cause to why they might be behaving in a challenging way.
I think there were occasions, certainly with us working with teenagers, where we can see some pushing of boundaries and we have to reinforce those. It's really, really important. But on the whole, I just try and stay calm. I just try and keep my voice level and just try and redirect and try and diffuse the situation as best I can, really.
The main thing is actually trying to identify when it's going to happen, when it's likely to happen, and then try and avoid it. But when it has happened, then it's trying to find out why it happened so that we can try and prevent it next time. And again, is working as a team that really helps. Working as a team, talking to the person, finding out why, when they're a lot calmer later, and just finding out why, and trying to find the ways that makes it better. Because I think it's also very difficult for them, as well as difficult for me and the rest of the team whenever I got into a situation like that.
I've got very good training in terms of conflict resolution and developed very good skills as a result. And also I've had experience of coming in contact with people that will present with various types of difficulties. And therefore, the very first thing that is important is to try and have a good understanding of why this person is behaving in the difficult manner, because that means there is a specific need that needs to be met, or maybe needs.
We also work with families as well who can become very, very distressed. And I think what I try and do is take a step back in that moment and remember why the person is there, why the families are involved, and I think just try and keep that in mind.
We talk at a very early stage with our students about skills of de-escalation, and to enable our students to recognise when patients might be becoming more emotionally aroused or having a heightened emotional state. And the idea would be that the earlier that they can intervene using good listening skills, good communication skills, awareness of body language, it might then stop a situation from developing and becoming more difficult.
What I found about working with people who may become physically or verbally aggressive is that this often comes from a place of fear or anxiety. And if we give people sufficient time to talk about those fears or their anxieties about where they are at or things they're experiencing as a result of their mental illness, that often can mean that they will find ways of expressing that which doesn't have to come through verbal abuse or acting out physically. And by no means is this a common experience. These incidents are rare when they do occur, and we do get great training to make sure that we manage them appropriately and safely.
I think we're human, aren't we? And when someone's, maybe very distressed or very anxious and is telling you that you're the reason that they're not getting better, or you should be doing more for them, or it's hard, especially when we're in this job because we're caring about people. So sometimes, especially if you're tired or you've had a really busy day or you've got lots of other things to do, if someone's saying that to you, it can be hard sometimes to not take that on board and take it very personally.
Again, it's just being objective, knowing why I'm here, And that actually at times they don't realize what they're doing, because when they get better they say sorry at times. And at times that's just the condition as it is. For example, if they have dementia and they're deteriorating, they don't realize this is what's going on. And then it's trying to find the ways to work with them, what works for them as an individual.